Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And I decided to do this recording for multiple reasons. One is this is actually a live presentation that I gave in San Diego a number of years ago. So if you're viewing this recording and if you were one of the 200 people that was in attendance in the live lecture, then some of these words may sound familiar. But how to develop a research question is something that is really at the heart of understanding how to do research. Because even though at the outset it may seem like this is something, asking a question is something that is very much fundamental to human nature. You want to know. We're inquisitive beings. We're curious. But when you're trying to formulate a research question, that changes to understanding how to ask a question. So that's the challenge. And I'm going to show you exactly how, at least provide you with several tools as to how to develop a research question. So let's get started. I'm going to go over a couple of models. Bloom's taxonomy you might have heard of. Go over some sample questions and then tell you about the types of questions. So, and some of this information actually might have changed since before, but I just wanted to show you. I created this table, and at the time, I wanted to show the different types of research studies that exist. And I divided it up by program type, but that's no longer really relevant. So what is more important is that in quantitative analysis, and not many people know this necessarily, there's two types of research. So there's primary data collection, which leads to a type of research, and then secondary data analysis. So what do I mean by two types? So one is where you classically think of a research study. You go out into the community. Maybe you are asking questions door to door, or as I've done before, doing telephone interviews, or even sending out questionnaires through the mail. That's something I've done as well, and trying to determine your responses. That's one way to do it, and of course, the processes behind that of creating Excel spreadsheets with addresses, and having automated systems where you can match addresses, and then mail out surveys within the community. I've done primary data collection many types. But then there's secondary data analysis, and I want to spend a little bit of time talking about this here because there is terabytes of data. There's big data now available. There is data, so much data out there, and not enough analysts to try to process these. And definitely, this is very specific, not only to public health, but to many disciplines. So it makes more sense in many instances because the sampling system that many larger organizations have, you necessarily don't have those resources. So the sampling systems make for more representative information at the end of the data analysis process than if you were to collect primary data. Now, primary data a lot of times is needed in populations that maybe there's not enough information about. For instance, maybe institutionalized populations, there's not as much information. But even there, that you can do a data set search from various databases, but Google has a data set search. Google has a nice database. Then, of course, there is the means to do qualitative research. Definitely, these techniques are enhanced much more by artificial intelligence. Sentiment analysis provides another dimension to the classic thematic analysis that we're all used to through phenomenological studies. Looking for newer ways to enhance the traditional qualitative techniques is extremely important moving forward. Sentiment analysis provides a very very sort of collective understanding of the theme of kind of the mood of certain words. This can be a powerful qualitative technique. So what I'm trying to show you here is this. I have actually presented quite a few techniques over the years, Pico technique and others, that would allow you to create research questions. But you can actually use something even as basic as Bloom's taxonomy. You can use something like this to try to create questions. And so when you're creating the question and evaluating and analyzing and applying, like what is it that you're trying to do through your question? That's what you need to first ask yourself. Um, if you're a lot of times you're starting off by remembering, but when you get to actually formulating research questions, you're operating at the level of creating. Sometimes, of course, evaluating, but then also creating. So it's it's a process, and so some of these objectives. These are good for creating objectives, but then also these words are good for trying to understand research questions. Now, I'm going to give you a little bit of some additional information here. This may not be the actual like quantitative research question that you're asking. This may not be actually even part of it, but this is trying to get you to think Gestalt kind of at a broader level before you get into the weeds and start understanding about how to formulate the research question. So I hope this makes sense. This is understanding a broader level approach. So now I'm going to share with you some tips, 3 tips actually, question tips. Think about how your question will start. So in prospectus or any sort of proposal, research question is like the symptom of how healthy your proposal is. If you have a good proposal, you have a good research question. The research question will tell me exactly, you know what you are looking for. And understand that this is an iterative process. It's not a one-time deal where you have a research question based on availability within the existing data sets. You'll have to tweak your questions. Now, what I want to go over a little bit is to talk about how to understand research questions. This is actually a pretty simplistic sort of model in understanding if your research question is too narrow, if it can be basically answered by one number. For instance, is it a percentage you're asking for, or is it something that requires a little bit more complex analytic reasoning? To formulate research questions which are much more um, uh, uh, kind of complex analytics, you have to be able to understand if your question is too broad or too narrow. So, for instance, if you're asking just for the childhood obesity rate in Phoenix, Arizona, then I could probably just draw up a map and in geospatial real time show you last year's rate. And it wouldn't take much time. So this I would consider too narrow. Now, what's something that is too, unfocused? Um, so, like, what is the effects of childhood obesity in the United States? That doesn't really say much. But if you're saying how does childhood obesity correlate with academic performance in elementary school children, that's a little bit more focused. And depending on what type of research question you're asking, the wording might change, and so that's how you would try to make sure that you have the right type of research question. So the four problems with research questions are as follows. They may be too narrow. They may be unfocused and too broad. They may be too objective, and they may be too simple. So if you actually can go through these four and say that they're not, then this is one way to kind of narrow down to get to your research question. So that's the process. So let's go into and because this was something I delivered in San Diego, I talked about this. What is the prostate cancer rate in San Diego, California? And like I said earlier, this is just simply too narrow. It can't. It can be answered with a simple statistic. I can again give you a geospatial. I can go into exactly. I can tell you 2021 county health rankings, and I can give you a precise number. Or otherwise, in the SEER dataset, even this might be available. How does the education level of the parents impact childhood obesity rates in San Diego, California? This is correct amount of specificity, and results would provide the opportunity for an argument to be formed. Questions about these are from actual Walden dissertations. I went through a number of them and wanted to see some that really stood out. And one was participation in drills and exercises a factor for improving times for staff notification, staff assembly, and completion of an after action report? What impact does staffing of local health departments in rural communities have on the availability of programs or services the health department is able to offer? So kind of like health services, but these are questions that are pretty specific. Do chronic diabetic patients experiencing acute care, and this is pretty specific, acute care episodes of illness contingent with their chronic conditions have better health outcomes, reduction or elimination of the top 10 comorbid conditions resulting in emergency room visits? Hypertension, fluid and electrolyte disorders, chronic pulmonary disease, deficiency anemias, renal failure, obesity, congestive heart failure, hypothyroidism, depression, and peripheral vascular disorders when enrolled in a PSHI MCO than those who continue to rely on a public hospital emergency room for care. So there's a lot of different uh, moving parts to this question. Instead, you can say to what extent is the health outcome of chronic diabetic patients improved for acute episodes of illness contingent upon their chronic condition? Or you can even say, do the health outcome of chronic diabetic patients improve for acute episodes of illness contingent upon their chronic conditions? And so it can be a yes no answer, that because in quantitative studies, the null and the alternative are in a way derived from more yes no versus to what extent. So um, but the idea is, when you're asking these questions, you want to make sure that you have enough specificity so that the reader is clear on exactly what you're studying. So if I would be looking at this as a reviewer, I would ask the student to simplify this a little bit more so that by the time you're at the end of the question, you haven't forgotten the beginning. And it makes a little bit more sense. But otherwise, I mean, this is actually an acceptable question. So these are other real questions that are from actual dissertations, qualitative, quantitative questions. What are the local community members' perceptions of the public health department in rural areas? Were there any significant differences in the frequency men had a prostate-specific antigen test by age? What were the independent effects of income, race, ethnicity, age, any healthcare coverage and cost on on prostate cancer screenings, on frequency of screenings? So cost versus frequency, again, looking at healthcare utilization from the context of cost. What are the perceptions of health policy experts in Nigeria on the adequacy and impact of the economic claims made in the country's health policy over the period starting in 2004 and ending in 2015? So looking at perceptions of health policy, in what ways does personal knowledge from the basis of personal attitudes towards risk factors and methods for coping with hypertension, and how does knowledge gained about hypertension influence dietary and physical exercise practices? So all of these are nice questions, qualitative, quantitative. These are, and sometimes what do you want to do if they're like, some of them could be diamonds in the rough. You kind of have to fine tune it and hone in and make sure it's specific enough. So that sums up everything that I had presented. There was some interactive parts to this. And of course, I'd gone over some other things as well. But this was a word cloud that I created from putting in a lot of the dissertations all together. And in a way, it's a qualitative word cloud because it shows some of the focus points of what is being studied. And so, of course, hypertension is front and center here, and with diabetes. But looking at also policy, a lot of people had been interested in this. Of course, chronic conditions are just as important to be understanding as emergencies. I mean, what do you do during an emergency of a chronic condition? What do you do during an asthma attack? What do you do when you have an emergency? And then complicate that with the next word that's right next to it, rural. What do you do if the places that are available are an hour away and you have an emergency. So, everything builds on each other and complicates the other matter, creating for really the perfect disaster. And so you have public failure, you have all of these conditions, you have impact, and you have the factors. So factors precede um, the condition, and then the impact is what is after an intervention is implemented to address conditions. Um, so this is showing from all the topic interests, just the the plethora of research topics that you can explore in a community setting, or by conducting secondary data analysis. And I want to end by kind of providing you with a distinction. And this kind of evolved from a conversation that I had with a colleague about talking about understanding that a research question is actually something that is part of a proposal, whereas a question that you would ask for a respondent is more of a study question. So there's a distinction between the question that you would individually ask a subject or a patient or a respondent versus a research question that is informing the broader framework of the study that you're conducting within the community. So that distinction is important to be made. And there's a lot of literature search strategies. Of course, Google Scholar is found everywhere, but understanding how to conduct subheading searches, mesh searches, things like that, PubMed, is extremely important and useful. And to also use Pico framework, which I have lectured on elsewhere, looking at the population, interventions, comparison group, and then also looking at outcome. So there's just so many approaches, and I've gone over Bloom's taxonomy, of course, in great detail here, and also other approaches. So these are the ways to hone in on your research questions. So I hope I've armed you with several tools to be able to effectively do this. Thank you for listening.